Thank you. Yes. I'm Ron Bachman, Senior Fellow at the Center for Health Transformation, and my mission in life is to solve the uninsured problem. And so the transparency issue before us today is very much a part of that, in my opinion. Transparency means the public disclosure of honest, meaningful decision-making information. Clearly, the public has a right to know key information to maintain their health and safety. When up to 98,000 patients die each year from hospital errors, citizens have a right to know where these are occurring. When now 9,000 deaths occur from medication errors each year, the public has a right to know the facts. When hospital-created complications and provider-induced viruses are more deadly than the original medical condition, patients have a right to know. The best way for the public to change poor business behaviors is to improve quality and lower costs is for the guilty businesses to lose customers. Unfortunately, in healthcare, the consumer is rarely the customer. The consumer is one who uses the service. The customer is the one who buys the service and pays the invoice. In healthcare, the customer is usually the third-party payer, the insurance company, the HMO, or the group plan. New generation health plans are financially empowering health consumers and transforming them into health customers. To become an effective health customer, one has to have both a financial stake in purchasing and the information to make informed decisions. You cannot have a quality health care in any system without both. Financially empowering plans with savings options increased 5% in 2007 and 8% in 2008. Employers with 3 to 200 workers are the fastest growing group, up 13%. With account-based plans, individual worker premiums are 40% less than other plans. Family premiums are 30% lower. The average employer account funding is over $800 for an individual and over $1,500 for family coverage each year. In 2008, 71% of employers offered incentives for health and wellness or disease management programs, up from 62% in 2007. The incentives averaged $192 per person per year. Account-based plans are not just for the healthy and wealthy. In 2009, young families 25 to 40 had balances averaging over $7,000 in these accounts. By the end of 2008, the average savings accounts total over $8,000 for individuals and over $10,000 for families. The newest products are developing more information to help individuals make informed choices with those dollars. Historically, transparent cost and quality information has been hard for plans and the public to access. Providers have maintained the argument of confidentiality, proprietary needs, and competitive advantage. With empowered individuals, these arguments rapidly dissipate. National insurers, some providers, specialty vendors, and state governments have been taking the lead in requiring disclosure of provider cost and quality information. Each insurer or hospital has limited data. States differ on their reporting requirements. Budgets limit the expansion of publicly funded information access, and inertia of the status quo slows progress in meeting patient information needs. The federal government can advance the cause of empowering individuals with information by passing basic national standards for provider and insurer transparency. Congressman Nathan Deal's legislation is on the right path. A governor of Georgia once said that to have better prisons, we needed better prisoners. Today, that parallel may be to have better health and at lower costs, we need better patients. The CDC tells us that behaviors determine 50% of health. By far, the individual turns out to be the most important variable in the healthcare cost equation. It's not doctors, hospitals, pharmaceuticals, or other care providers. Access to care has only a 10% impact on health status. Genetics 20%, environment 20% make up the remaining factors. Congress is a powerful legislative body, but you cannot change the laws of human nature. You cannot make recalcitrant patients take medications or comply with physician orders. You cannot make citizens eat properly, exercise regularly, or seek preventive care. The bottom line is you cannot legislate personal responsibility. Congress can, however, create an open, transparent, information-rich environment that supports greater engagement by individuals in their own health and health care decisions. In general, individuals will not take care of themselves just for the sake of good health. If that were true, we would not see the rampant growth in obesity and epidemic of diabetes. We are typically American. We want to be paid to do the right thing. We want incentives, rewards, and recognition. We want some financial control, and we need information and help with making the right decisions. Blue Cross Blue Shield studies show that patients with financial and information support have more than 3 times the number of members engaged in smoking cessation, more than 3 times the number of members engaged in stress management programs, more than double the number in diet and nutrition education programs, and nearly 2.5 times more likely for those patients to be in exercise plans. A major interest in Congressman Deal's legislation is disclosure of self-pay charges. When I started to negotiate provider network reimbursements back in the early 1990s, the expected discount from hospital charge masters, their so-called retail price, was typically 5 to 15%. The discount game has led to artificially high retail price lists where discounts are now 80 to 90% off of those charges. No one pays the retail prices except the uninsured. Those most vulnerable and least able to pay are charged the list rates. Many who cannot or do not pay these artificial charges are hounded by collection agencies for monies that are 10 times or more above the cost of actually providing the services. As with the Georgia governor's call for better prisoners, it's time to free consumers from the dark prison of ignorance. You can make information easier to find and easier to understand. You can eliminate arbitrary price discrimination against the uninsured. The need is to pull back the curtain of secrecy on cost and quality. Congress can make a difference in saving lives and saving money by supporting the individual's right to know. While the country debates reform of health care, on one fact you should all agree: the need for transparency is critical to the outcome in that debate.
Thank you, Mr. Bachman.
I think, Mr. Bachman, you almost sounded like I wrote your speech for you there. I think I agreed with virtually everything that you said. How do we deal, though, with this question of disclosure of pricing, price transparency? How do we get a handle on that? How do we best accomplish that objective?
Well, there are a number of areas. First, I'd like to say that the transparency that I believe is appropriate goes beyond even what's been suggested in your bill here. I think transparency on service costs, how well you're being treated, the time in the waiting room, bedside manner, things that are not clinical but are more service-oriented is important disclosure. The way we get at it, I think, is a couple things. One of the issues that was not mentioned in the earlier panel, I didn't mention it and I hadn't heard the words here, is the internet. We're now seeing a tremendous growth in what's called Web 2.0. People talking to other people about their experiences with providers and physicians. So we're having people talking to other people that's creating a disclosure. That's one thing. The second thing, there's a growing interest. It's slow, but there are vendors out there that are beginning to encourage providers to create package pricing so that you have one price. How much is it going to cost to treat my diabetes for the next 12 months? And that way, if there's a package pricing, it's sort of a combination of the old capitation rates and fee-for-service mainly, but it's where the provider says, I can take care of you for this amount of money, and the services don't have to fall into the traditional CPT codes or ICD-9 or DRGs. It's what the hospital can show and demonstrate will work best, and employers are buying into that, but that is only at the beginning stages. The third area that's going to push that is what is actually happening. I think your charts showed a third world country. Well, that is actually happening today in most of the areas like Singapore and other countries that are getting medical travel, medical tourism, if you will, and hundreds of thousands of people are going across the ocean in order to get services that are 1/10 the cost at better hospitals, more modern hospitals, many of them managed by the major brand name facilities in this country, and they're being treated by doctors that are trained in the United States as well. So, and they're being approved by quality organizations that approve quality hospitals in the United States as well. So I think there's a gathering of a number of forces to push this in the right direction.